Welcome back to our Courage Sessions. We are so excited to have a really fantastic panel joining us today from the Tour for Diversity in Medicine group. But before we do introduce them, we'd like to welcome everybody here to the Courage Sessions. My name is Enrique Hasso. I'm the Associate Director of the Texas Health Education Service in Austin, Texas. And as you all know, we are part of the TMDSAS application service, which also includes the Joint Admission Medical Program. So joining us today, we have a fantastic panel, as I mentioned, and I'm just going to go ahead and let Dr. Anani take it out as the moderator for today's panel.
All right, thank you. We are very excited to be here. We're happy to be live streaming to you all. I'll introduce myself. We're going to do names. We're going to do our college, our med school, and then our Texas affiliation. I'll go first, and then I'll call out each mentor here and they can introduce themselves. So my name is Anani. I do emergency medicine. I went to Carleton College in Minnesota and I went to Howard University College of Medicine, but I am from Houston, Texas, Southwest Texas, Beltway 8 and 59 to be exact, where all the Nigerians like to stay. So I will pass it on and I will let Dr. Freeman introduce herself.
Sorry, getting off of mute should be easier than it is. So I am Dr. Brandi Freeman. I am a pediatrician currently in Denver, Colorado. Let's see, I went to Duke University in North Carolina for undergrad, then came back home to Baylor College of Medicine, go Baylor, for med school. Let's see, my Texas connections, I'm from Houston. I grew up Southwest as well, initially Alief and then further Southwest out to Fort Bend County, Dulles High School.
All right, gotta love the leaf. We will now have student Dr. Chavez introduce herself.
Hi everyone, my name is Janelle Chavez. I graduated from the University of Texas at Austin in 2019, and I'm currently a second-year medical student at Stanford Medical School. I am originally from Port Isabel, Texas, which is a really small town way down south, like way down there in the southern tip of Texas. So I'm here in California now, but still love Texas, and I'm really excited to be here tonight talking to y'all about the application process.
All right, we got some hook'em on the panel today, so you always love that. Dr. Lott, you can go ahead and introduce yourself.
I'm Dr. Nathan Lott. I'm a pulmonary critical care physician currently in Waco, Texas. I went to the Prairie View A&M University. So went there for undergrad. Med school, I went to Ohio University College of Osteopathic Medicine where I graduated and did my residency and fellowship training in Ohio, and then wanted to come back home. I'm originally from the Houston area, Northwest, Acres, Fofo. So those that know. If you don't, you'll learn.
Always good to have PV in the house. And judging by the smile, I'm sure Dr. Shai would like to add something on to that. So Dr. Shai.
Absolutely. Good evening, everyone. My name is Corey Shai. I'm a first-year hospitalist at Barnes Jewish Hospital, WashU University. Grew up in Lufkin, Texas, and then went to undergrad at the Prairie View A&M University before going to med school at Texas A&M University. And I was also part of GEMP at some period of time also, so a lot of Texas connections. Before going to residency at WashU in St. Louis, where I stayed on as a faculty hospitalist.
Would you like to introduce yourself? All right, that's the whole panel. So to everyone watching, what we'll do is we're going to start off with, the usual casual questions. If you're watching on Facebook, if you put them in the chat, Enrique will port them over to our chat here so we can see them using the platform we're using. If for some reason you're watching on your phone and you prefer just to send a tweet, we'll see it at some point, hopefully. But hopefully if you can use the chat box or feature you have, that'll be easier for us to see. One thing, if you've never been to a T4D or Tour for Diversity in Medicine function, you should know we're real, we're honest, and we prefer to answer your questions. That's why you're here. So we're going to start off with a few stock questions, but feel free to put questions in the chat because we would much prefer to answer those. So open up to anyone on the panel. I'll take one of the ladies and one of the fellas. What factors did you consider in selecting a medical school? And I will take one MD and one DO. So since I'm taking a DO, Dr. Lott, you're locked in there. And I will start off with student Dr. Chavez, actually, since she's currently in medical school. So I'll have you go first, Janelle.
A lot of factors. I think one of the biggest ones for me was the patient population that I'd be working with at the school. And that was something I didn't really think about until I was actually interviewing at different schools and saw what the city is like, what types of patients they have. Do they have a free clinic that serves medically underserved patients, a VA hospital for veterans, children's hospital? I think that's something that's really important to consider when you're thinking about where you want to attend medical school is what kind of patients will I see, what's the education like here. Another thing is location, where you think you can see yourself living for the next 4 years, if you'll be happy. In addition to that, I thought about the curriculum. Does this school emphasize research? Do they have a support network there where you're required to do a research project? Are they more community focused? Are there opportunities to get engaged with the community? That was something that I started to look into once I was interviewing at different schools, but something that you can definitely find when you're researching schools, find their mission statement, and you can kind of figure out what they're all about. And lastly, one big thing that I took into account when choosing school was finances. That kind of played a big role in is what schools have scholarships within the institution and outside. So it's kind of a combination of location, patient experiences, education, and then of course finances kind of helped me figure out before I was interviewing, before I got a feel for the school myself. Those were kind of factors that I had in mind when I was choosing to apply.
Great factors. Could you let us know some of your factors, Dr. Lott, and if you can include any reasons why you selected DO over MD as well?
Well, when I was in undergrad, we had a seminar program where our director was inviting people to come in and speak about the different aspects. We have a large pre-med program, but a lot of allied health as well. So people come in from dentistry, we've had physical therapists, occupational, and one of the speakers was an osteopathic physician. And my interaction with them during that seminar really piqued my interest in the field. And at that point, I did a lot of reading, research, looked at a couple of things, and that's what really kind of propelled me towards that particular branch of medicine. For those that don't know, osteopathic medicine is the other fully licensed practitioners of medicine and surgery in the United States, the counterparts, as they say, to allopathic physicians. And my interests lie in the origins of osteopathy, where the focus is on, the whole patient and the holistic approach to medical management, and trying to embrace the humanism in medicine. So those are the things that really prompted me to pursue osteopathy as the branch of medicine that I was interested in proceeding with. As far as which school, for me, I knew my learning style. I've never been what you would call a lecture-based individual. I have a tendency to fall asleep when people talk at me. So curriculum was extremely important to me. And the school that I chose had a very self-driven, self-directed learning program where you worked within a group, and you as a group came up with your learning objectives, and you covered everything that was covered in the standard lecture-based curriculum, but it was done at a pace that worked for you as a student, and you could go as deep or as shallow as you wanted to, but knew that if you didn't hit the depth that you needed to, you'd probably not do that well on the test that you need to maintain your licensure and get out of med school. So those were kind of the big things for me. I figured, money is what it's going to be. The cost of education is what it is. I knew if I left the state of Texas, it was going to cost a heck of a lot more than if I stayed. But, I went where I felt led.
Oh, thank you for that answer. So for the students out there, let's say they now looked up the schools, they did their research, they figured out what type of school they'd like to apply to. So now it's time to apply. So I'm going to have Dr. Shai and Dr. Freeman answer this question for me. How did you guys feel applying to the TMD SAS schools differed from applying to schools outside of the system? And bonus question, how many of the schools did you apply to? Did you hit apply all? Did you select them? Was it about staying in Texas for you guys? And since Texas has a lot of schools, how did you feel applying outside of Texas? Did you double that number, match that number? Thoughts? I'll start with Dr. Freeman, because ladies first.
Okay, so I think for me in looking at schools, I think being from Texas is a huge benefit in applying to medical schools because I think we have more medical schools than almost any other state. And so when I applied, I did apply to, now there were less medical schools when I applied because I'm not as young as I look. But I think there were like 10 at the time. So I applied to all of the Texas ones. And then I also did AMCAS that Baylor was a part of at that time. And then for me, it was thinking about, one, not wanting to overtire myself, but also giving myself my best chances. And thinking about the number of medical schools in Texas versus the number of people applying, that actually the numbers are much better. I think when I was applying, I think the medical school acceptance rate nationally was like 30%. And in Texas, it was like 50% because we had that many medical schools. And I think there are a number more. Enrique has helped me out and given me some actual data where there are now 12 medical schools that are part of TMD SAS, and an additional 4 dental schools, and then 2 veterinary schools. So a huge number of schools that are within that system, and then a total of 15 medical schools that are in Texas. So if you just think about it, that was one thing. I was like, thank God I'm from Texas, which, it's just true.
Everything is bigger and better in the state of Texas, that is for sure. Dr. Shai, I'd like to hear your answers on how many schools you applied to, all of them, and how you felt using that application in comparison with the general AMCAS application.
Gotcha. So in full disclosure, so me and Enrique, we go way back, probably back to 2010, because I was initially in the program JAMP, which stands for Joint Admissions Medical Program. So it's an early admission program that's kind of geared towards usually students who are a little bit undeserved or kind of first generation, or parents make under a certain amount of money to try to get some more of that representation in the medical school. And then you pretty much get a guaranteed acceptance into medical school as long as you meet a certain MCAT criteria. And so during this time, I was in this program, so I was just thinking about applying to only Texas schools. However, things didn't always go how I wanted to, and so I didn't make the MCAT score after my 3rd time taking it, so I was unfortunately kicked out into the program. However, I still do remember initially applying to all of Texas schools at the time. And so the thing I remember, and this was in 2012, so I believe it was either 9 or 10 schools at that time. And so I remember the difference between TMD SAS and the regular AMCAS was the Texas school deadline was a lot earlier than the other. And so I remember, I think I was turning in my applications around May or June. And I got like I think I got 2 total interviews, but I think I got interviews before I even completed my other application. And so I think that was the big difference. And so I know a lot of people, especially if you're in Texas, were applying to a lot of the Texas schools and getting a lot of secondaries in and maybe getting a lot of interviews in before you would even start or finish the general application. And so I initially applied to the 9 or 10 Texas schools. And then for the out-of-state schools, I ended up applying to maybe 20 or 30 programs. I applied for the fee assistant program, and I applied to a mixture of MD and DO programs. But fortunately, I was in JEP, and so part of the JEP, you have these 2 summer programs that you can do, and one of the summer programs I actually did really well at Texas A&M. And even though I didn't make the MCAT score, they saw me for a full summer, and so they still actually extended me an interview, and they early accepted me. And so I ended up pulling out my application for all of the other medical schools, and so I didn't interview anywhere else besides Texas places.
So here at Tour for Diversity, we like messages. So sometimes I'm gonna stop with the questions I'll say the word message and then repeat something we hope that y'all heard. So there were 2 messages in there in what Dr. Shai just said. Message number 1, you can fail to meet somebody's criteria, whether it be for MCAT or GPA, and still get your white coat. In fact, he's still wearing his right now as we speak. He didn't meet the cutoff for the JAMP. He's still a physician. So don't give up on your dreams. Number 2, whenever you have something in front of you, do your best at it because you don't know what's going to lead to down the line. He did well in the summer program beforehand, so well that when he applied later on, after not meeting the cutoff of the program, they still wanted him and accepted him early. He was able to turn down everybody else because he already had it in. So again, because you fail at one thing doesn't mean you can't get where you want to go. And when you are someplace, do your best and be your best because it can lead to something great down the line. So since we're still talking about Texas schools, you mentioned something I would like to ask student Dr. Chavez on, and I'll ask Dr. Freeman on it again. You get to go twice back to back. When applying to schools in Texas, the timeline seems to look different. I know there is one on the website, go to the website, and it seems to be a lot earlier. How did you guys adapt to that earlier feature with the MCAS? Did you bug people earlier? Did you use 2 different letters of recommendations? How did you work through that process? Starting with student Dr. Chavez.
Yes, so I became aware. I didn't really know a lot about the application process, having not really known anyone gone through it, except for like maybe students in the classes above me at UT Austin. So kind of asked around and figured out that the application was very early. So I started planning. This was some advice I received from an older student, was to, in the spring semester of my junior year, which was when I was applying, was to get all the activities that I had together. That was one thing that I could do. I had already taken my MCAT. It wasn't the opportunity to start working on my application yet. The portal hadn't opened. So in that weird in between time, I started thinking about all the activities that I'd done, all the service I'd done, and organizations, all those things that you will fill out when the application opens. And I started coming up with little paragraphs about it. That's kind of how the application program process works. So everything, I got a list and started writing like really good paragraphs about all the things that I'd done. And I got that in order around March or April. And around that time, I also started asking my professors for letters of recommendation, giving them at least a month in advance of when I wanted the letters to be written. So that way I had everything populated. I had started working on some essays, my personal statement, so that when the application did open in around May or June, I'm not sure, fact check me on that on the website. But when it did open, I had everything ready. My essays were ready and I was just ready to copy and paste things in. My letters were ready. So I was really grateful to have students in the classes above give me that advice. So I was able to apply pretty early and received interviews very early in the summer, even before I had finished the AMCAS application. And that just took a lot of stress off of me, having interviews early and receiving acceptances even by December from the first round. So that was really nice to have that load of stress taken off of me, especially because Texas schools are on a rolling basis. Most of them are. So there's some sense of urgency to get it in by that early timeline.
Great point. And the fact check we just got was for entry year 2021. So starting this year, the portal for application opened May 1st at 8 a.m. Central Time. And June 1st, applications were transmitted to schools. So that kind of shows you how early the timeline is there. Dr. Freeman?
So I think for me, I think one thing that was really helpful was just how early it was. It helped me make sure that I had everything done. I was in a post-bac program in Minnesota at the time. And so it made sure that I had not only, testing and everything done, but all the letters and everything in, which was very much appreciated. I also very much appreciated the cost differential between that application service and AMCAS, where I believe like TMDSAS is like $185 for all of the schools if you wanted to, plus then secondary fees. Let's say, I don't remember how much AMCAS was, but I know it was more than that. And so it was definitely an affordable thing where it convinced, I was like, I could put my hat in the ring for all of the schools. I do think back when I was there, it wasn't rolling admissions, so that was helpful. There was a match back then, which tells you how old I am, I guess. But yeah.
All right, thank you. So we have our first question, and to make me an honest person, I'm gonna go straight to their question and deviate from what I have. The question for the two male doctors on, Dr. Lott and Dr. Shai, do you know of any, for the older non-traditional students, do you know if they're eligible for any summer programs, whether it be with JAMP or with anybody else? And if you aren't aware of any summer programs, would you have any advice for non-traditional students, older non-traditional students, to stand out? Starting with Dr. Shai, since you gave your great JAMP story. You got to unmute yourself, Dave.
Sorry about that. Yeah, so regarding JAMP, they do have a pathway for non-traditional students. You can go directly to the program for that information. I can give you the email, which is info@texasjamp.org, to reach out to them for kind of further information and detail regarding that. And then regarding other summer programs, unfortunately, I'm not aware about any other programs. I'm sure they are some, I just don't have them on the top of my head regarding different summer programs. But I know for sure, as far as research, that would be also a good thing to kind of stand out to do in your summertime. And a lot of times, those are going to be, you can get those paid, and it can be even higher paid than like a summer program may do. So a lot of summer programs are really great experience, but a lot of times with people in college and usually not working, or maybe have a family or anything like that, and so they're not really getting compensated much, maybe a small stipend. But sometimes a lot of the research ones, you can actually get a significant amount more money, which may be more feasible for your schedule and where you're at in your career. But I know a lot of times what I did, and a lot of other people, you can kind of search different things, and there may be a lot of different things out there, and you can maybe cater the search or as non-traditional students. And so that's where I would kind of start off.
Dr. Lott, do you have any programs or just overall advice for older non-traditional students?
I don't have any specific programs that I am aware of. That being said, if you search, have an interest, look for the different programs that are available. Some of them may be able to help provide some of that guidance. I would say that you're never too old to go. One of my classmates, when I was in med school, was a tenured professor at the school. And she left so that she could pursue her dream of becoming an obstetrician and gynecologist. So it's never too late. If it's something you really want to do, go for it.
Agreed.
I would just like to say something real quick also, just to add to that. Yeah, I had a lady in my medical school who was a year or two below me. She was a OB-GYN nurse for 30 years and then decided to go to medical school in her 50s. Her kids were older than me.
That happens all the time. So Enrique is putting in the chat, and I was just about to say it. Probably the biggest, at least to me, national program is SHPEP, SHPEP, as I like to call it, because we used to call it SMDEP when it was MMEP and all the other acronyms. That's the biggest program for summer programs. A lot of the times, though, they are just for freshmen and sophomores. So if you are non-traditional or out of that timeline, you may not qualify for that program. However, there are several programs similar to that. If you are in that timeline, the website is www.shpep.org. I recommend everyone goes there. And if you are older, non-traditional, just based on age, but you still meet the qualifications for a freshman or a sophomore, you can still apply to that program. So it's not about your age, it's about how far you are along in your undergrad tenure. So I want to put that out there for everyone watching. And a reminder that Dr. Freeman is not as old as she says, and if it's broke, don't fix it. TMD SAS still uses a match process. Medical schools begin extending their offers using this year as a timeline. They started extending their offers October 15th. Match preference submission was due by February 19th. And match results went in March 5th. They're announced and rolling admissions continue. So it continues, it's still there. If it's not broke, no need to fix it. So I just wanted to put that out there for everybody. So we will go to a question for student Dr. Chavez and Dr. Lott. When you were applying for schools, what are some of the things you wish you knew you were applying that you'd like to pass on now? Starting with Dr. Lott.
Man, things that I wish I had known then that I know now. I wish I had known.
And you can't say COVID.
I wish I had known more about the differences in colleges. Like I said, when I was looking, I really had kind of settled my mind. This is the one spot that I'm going to. I kind of settled on Ohio University because that was where I got the information that really kind of prompted me to go that route. So, but had I known about some of the other options, funding wise from other positions, maybe I would have chosen differently. But that's really pretty much the only thing. I'm kind of more of I take the punches as they come at me and just roll with it and try not to think too much about what could have, what should have, or what may have happened later.
All right, student Dr. Chavez.
I think a really important thing is kind of the curriculum of the school or how the classes work. So as Dr. Lott was saying earlier, some schools have more collaborative based learning, problem based learning, where you're working together, you're required to go to these sessions. Others are very much lecture based and they're recorded, you don't have to go. Some schools have pass fail honors, internal ranking, things like that I did not know existed until I came to school, and I'm like, oh wow, I guess I'm glad that my school is this way because I didn't know there was any other way. So that was one thing that it worked out, but I would definitely look into, as you're going to these schools, okay, what is an average day like for a student? What are exams like? How are they evaluated? Because that kind of affects you for the first couple of years of medical school. It really does affect you the way that the school is. And the only way, or I think the best way to figure that out, is talking to current students, which I didn't do enough of. Even on the interview trail, I was just kind of nervous, didn't really want to ask anyone. The med students gave us tours, but I was too shy to ask any questions. But I really encourage you to reach out to friends that you have at these schools, or when you're doing these interviews, to ask, what's an average day for you like? What would you change about your school if you could? What do you like about your school? These questions are really helpful, and medical students will usually tell you the truth, what it's like. And I think that's the best way to get an understanding of what it's really like to be a student there. And that's something that I don't think that I did enough research before and during my application process.
Great point. There is an old saying out there in those streets, closed mouths don't get fed. So yes, if you have a question, you want to know something, open it up and ask. We're about halfway through, so I want to make sure I take this time to dispel a few myths. So I'm going to ask about 3 minutes, go back and forward. Anyone can jump in and give your response on the myths. And if no one jumps in, I'm going to call y'all out in the way that I usually do. So myth number 1, I'm applying to TMD SAS. Do I need a Texas mentor or physician to write me a letter of recommendation? Thoughts? Myths, not myth. What do you guys think? Should the student have a letter of recommendation from the Texas school?
I'm not certain, honestly. I think having a letter of recommendation from a physician is adequate, but I'm not certain if it is a requirement that it be a Texas physician.
All right. So Dr. Lott's in the camp of, as long as it's a physician, it's good. Anyone have any thoughts? Student Dr. Chavez, or Corey has his mic unmuted, so go ahead, Corey.
Yeah, I think it's probably more likely a myth. I think if you're coming from Texas and if you're going to school in Texas or doing your post-bac in Texas and your experience in Texas, you probably have more access to having a physician write your letter of recommendation in Texas. However, we had quite a few people from other states, particularly Utah. We have a huge group, a Mormon population that does medical school in Texas, and so I don't think a lot of them necessarily had letters of recommendation from physicians or people from Texas, and so I don't necessarily think that is a requirement. I just think it's more likely to happen because a lot of people who go to medical school in Texas are from Texas.
All right, both of you guys are correct. It is not a requirement. The only letter requirements, as mentioned by TMD SAS, number one, it's written on official letterhead. Number two, the evaluator's contact information is there. Number three, it has their signature. Number four, it has the applicant's name. Number five, the letter must be dated by a specific time. And number six, it must be written in English because Google Translate doesn't always translate like you think it will. So that's another one. We have another student question, so I'm gonna pause my Mythbusters segment for a bit and make sure we get this one in. This one's gonna be for Dr. Freeman. Is it fair to say that the first 2 years of medical school are class-based and that the last 2 years are conducted through clinicals, meaning that the student doesn't have to be in the city where the school is for the first 2 years?
So that is something that is going to definitely vary by each school's curriculum and each school's resources. So for example, Baylor, I believe, only does a year and a half of basic science through classes, and then they do 2.5 years through clinicals. And all of their rotations, however, are in Houston. They're all arranged through the Texas Medical Center through all of the resources there. Now, different schools, like where I work now, the University of Colorado, they have multiple campuses. They have a Colorado Springs campus. They have a Aurora, our main campus. And so their students flip in terms of where their rotations are and are spread all over the state. You will be, for most US medical schools, your medical school will arrange your rotations for you, where you are most likely in the city that you are. There are some other schools that you may kind of do more rotating rotations in different states, but most medical schools will arrange for your rotations, usually if not within the city, around the state. And so that would be set up for you. So it's not like an opportunity where you would switch medical schools in between. If your rotations are in a different city, it would be because your school set them up that way.
So I know this is audio for some and visual for others. So I'm gonna ask a question and everyone responds at the same time. So everyone has to unmute themselves. If you agree, you say aye and raise your hand when I call for the ayes. And if you disagree, you say nay and raise your hand when I call for the nays. Everybody got it? All right, so everyone unmute yourself and I'm gonna ask the question when I see everyone unmuted. Please say aye and raise your hand if you recommend for a student to not live in the city where their medical school is for the first 2 years. Please say nay if you recommend, please say nay if you agree with or disagree with the student living elsewhere for the first 2 years. Nay.
Nay.
All right, the nays have it. So to that question out there in cyberspace, you should really live in the city. I know in today's times, living home may be better, but even if it's not for the clinical work, a lot of schools, like I went to Howard University, test days were every 2 weeks. There were tests that you had to do in person in the middle of it. And even though the clinical base was 3rd and 4th year when you're in the hospital, we still had problem-based learnings like student Dr. Chavez mentioned, which means I had to be in the room to do that. Obviously, with COVID-19, AKA that Rona, AKA, I don't like when they call it Miss Rona. That's kind of sexist. Like, why isn't it Mr. Rona? Because of that, a lot of student-based in classroom learning may be different, but that doesn't mean that's going to be forever. So just throwing that out there, whatever school you apply to, you want to be in that city limits at worst. So no more than an hour or so away, I'd recommend. All right. Going back to the myth busting for a second now. So we backed up. Myth number 2, I have to have a Texas address to apply to the TMD SAS. Anyone want to tackle that myth? All right, go ahead, Dr. Freeman.
So no, you do not have to have a Texas address to apply to TMD SAS. However, your tuition is cheaper if you do. So there are benefits to being a Texas resident, other than you get to live in the great state of Texas. But yes, everyone is welcome to apply.
Message. Go ahead, Dr. Shai.
I'd just like to add one more thing. A lot of people brought to my attention that even if you're out of state applying in Texas, that is still cheaper than most people in state. So keep that in consideration also.
Look at Texas coming through with y'all, saving dollars, saving cents. Everything's better in Texas.
That is true.
So this was mentioned earlier by Dr. Freeman, so she can't answer right now. So I'll start with Dr. Lott and student Dr. Chavez. Do you think your chances are better to applying to the Texas schools when not, and applying to non-Texas schools, right? We know there's 15 Texas schools. There's like 50 or something AMCAS schools. But let's just make it 15 to 15. Would it be equal? Would it be the same? Do you think your chances are better, not better? What are your thoughts there?
You have a much better option getting into a Texas school as a Texas resident than if you're an external applicant applying to get in.
All right, student Dr. Chavez.
I think so. I think that the odds are great because there are so many schools now, so many, a few popped up in just the last year, and Texas does have the match process, which is different from AMCAS. So it's really weird. You preference your schools, they kind of preference you. And then the point of it is to maximize the number of students that are accepted, as opposed to other schools kind of have a quota, like a number that they can accept. But I think the way TMD SAS works is that they're really trying to accept as many students as possible. So the match is really in your favor to be accepted through that process.
Very, very great. And plus it'll be practice, because when you get to the end of medical school, you have to do another match. So you might as well do it going in. All right, we have a question here, and I actually really like this question. Shout out to the person Enrique copied this from. So everybody has to answer it. The person said, psychiatry looks like a really cool field at the moment. That's just a fact to them. The question is, are any of you practicing in the disciplines you plan to when you first attended medical school? We'll start with student Dr. Freeman. It's not student Dr. Freeman, sorry, I'm reading across. Dr. Freeman, Dr. Shai, Dr. Lott, and then student Dr. Chavez, since she hasn't started practicing quite yet.
I'd say not exactly. So I had done a postbac where I was doing research in gynecology. So I thought I was going to be an OBGYN. Then I just decided to choose the better part, which is the baby, and stuck with that. So like they're related, but not exactly the same thing.
Love it. Dr. Shai?
Yeah, so I initially thought I wanted to do family medicine. I thought I was going to love the clinic, and I really hated being in a hospital. And then even up until a few months ago, I thought I was going to do GI, but I think I'm just going to stick with being in a hospitalist, which is all hospital medicine. So a complete 180 as far as when to be in the hospital.
Dr. Lott.
Well, when I started med school, my initial desire was to do cardiology. I was interested in being either interventional or EP because I like the pursuit of knowledge, esoteric, kind of brainy, blah, 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 blah. Obviously, that's not what I'm doing now. I'm in pulmonary critical care. My first rotation as an intern just took me away. And at that point, I knew what I wanted to do, and that's why I went into critical care.
I like. Student Dr. Chavez, are you still on track to do what you thought you were going to do last year?
No, I even changed within like a few months. I came in really like I want to do surgery, started attending all the surgery interest group meetings. My summer research was about access to surgery in Texas. But even throughout the first year, and realized that I really enjoy talking to people, talking to patients. Every time we're in the clinic is like my favorite part, going in the hospitals and hearing people's stories. So that's kind of leaned me more towards maybe a non-procedure based specialty. I'm also in some electives like a pediatric pediatric elective, which I love. I agree with Dr. Freeman. The babies are fun. So I'm starting to be steered a little bit away from surgery and towards something else. And I'm sure it'll change when I do rotations. I'll like something different, but it does change very much once you're in it.
And I will throw, I'm gonna do the bad moderator thing and answer the question myself as well. I'll keep it short. Yes, I am practicing what I thought I was gonna practice when I started medical school. I wanted to do emergency medicine to show ER look cool. ER is cool. All right, and for those who are just joining, who got in halfway through the stream here, you are sitting with mentors from the Tour for Diversity in Medicine and partners with the Texas Health Education Service, bringing you a panel on applying to school within the TMD SAS portal and practice. This is a courage session, so we're giving you the courage to go through it because we think everyone listening right now is already ahead of the game because you came to us for advice and you're not trying to wing it. So we're going to make sure that you score here. All right, we were going through some myths and busting some myths when applying to the TMD SAS. So there was only one more myth left and we've kind of hinted at it already. So I'll just ask it straight out and you can say it. The myth is I only should apply in the city I live in Texas and not everywhere in Texas. Thoughts?
No. Just want to apply to a single school. It's kind of like putting all your eggs in a single basket. When you drop the basket, you lose all your eggs. It's best to give yourself a little more variety. Apply in places where you could see yourself learning, getting a good education. It may not be at home, but someplace where you feel like you can get a good education, because ultimately you need to do that so that you can get through and graduate.
All right, very true. I like that answer. I personally don't put very many eggs in baskets as I used to all the time, but nowadays you never know. Also, in the Zoom world, cute children pop up from time to time, and we all must acknowledge them because they're cute, and why not? All right, so going to our next question. What can someone in high school do right now to prepare them for the journey to make it into medical school? So we're focusing a lot on those in undergrad. What about those who are really ahead of the game and in high school right now? Starting with Dr. Shai and then the student, Dr. Chavez.
Okay, so I think in high school, a good thing you can do, and something I didn't do and I regret, and a lot of you might already be doing this, but I would definitely take the pre-AP, AP courses. Don't skate like I did. And so that would really help out in college to kind of get that exposure, particularly to some of those maybe next level science classes. I think for me, I did the bare minimum, so I didn't do any A&P or any physics or any of that stuff, which I regret. But I think getting the exposure to that early on in high school will kind of help you out as far as college, as far as that's from the grade standpoint. But also in high school, I think just being able to shadow some physicians or kind of get some type of volunteer work, either that be working at a nursing home or something like that, is very important, just to kind of see as medicine is something you want to do. And so I wouldn't even be limited to just purely medicine. I would just probably check out different types of health careers in general, because you may have thought, since you were 4, you wanted to be a doctor, and then you really have no idea why you want to be a doctor, and you never seen a doctor. And so maybe there's another field that you might like better. Or even if within a doctor, you may have your eyes on being a neurosurgeon, but I think it's just, especially in high school, is just being exposed to any type of physician, just kind of seeing what's going on would be really good and helpful for you. And then you can kind of build on that as you go to college and kind of further along.
Student Dr. Chavez, any advice? No shade, you're the closest one to the high school compared to the rest of us. So any advice that you'd have for high school self that's watching right now?
Mm-hmm. Yeah, I think that was great advice. I've had, in addition to like AP courses, dual enrollment, like where you can get concurrent credit if your high school offers that to save you some money in college, but also time. So I did a lot of that undergrad. So once I went to in high school, once I went to college, I was able to take a lot more science classes and some electives. And because I knocked out some other ones along the way. Another thing is just getting good at studying, knowing yourself, knowing how you like to study, what time of the day you like to study, what resources, becoming a planner, like get a planner, use a Google Calendar. This is something I didn't really have together, and would be really helpful if you work on that during high school. So then once you go to college, you know yourself and you can really do well in classes. It's less of a transition when you are already doing well at time management. So that's just something helpful that would be helpful in high school, but even more helpful for college and medical school. And I definitely agree that it's great to shadow someone. I grew up not knowing a single physician, not ever being exposed, just kind of like the idea of science and of helping people, and thought maybe when I applied to colleges, I'll say I want to be a doctor, but really had no experience doing that. So I asked the physician in my small hometown. We have like one clinic with a physician assistant. So that's what I'd grown up going to. So I just asked my senior year of high school if I could somehow shadow after school any day. So I ended up doing that and shadowing every once in a while. And I really found out that I loved it. And that just gave me a lot of motivation to pursue it in college. And now I come back every time I'm back in South Texas from breaks from college and even breaks from medical school. Those are people that I regularly shadow, are people from my hometown and organizations and the people that I volunteered with at church and a choir. So I would say in high school, really take advantage of the opportunities that you do have in your community, know yourself and how to study, but also get involved with the community, whether that's the pediatrician that you went to or the church that you go to. Find ways that you can get involved and see if this is a good path for you.
I like that advice. High school, more time, less responsibility, use it. The questions are starting to pour in, so let's get to them. Did anyone take a gap year? Raise your hand if you took a gap year. All right, there's 3 of us. All right, so I'm gonna start with Dr. Freeman, then Dr. Lott, then myself. For us that took a gap year, would you recommend it? And if not, why would you not recommend a gap year?
Okay. I took a gap year because I needed what I call an enhancement year. I've been trying to get that to catch on, but it hasn't. So, because I feel like gap is something you like jump over. Enhancement is like something to make things better. And so for me, I was trying to kind of bulk up some things on my application. And so I did a formal program. I did a research program at the Mayo Clinic where I was doing graduate level research. I took some graduate level science courses, and then I retook the course that was causing me problems from undergrad, better known as Part 2 of organic chemistry. So for me, it was a way to like shine up my application and also made it possible for me to like have a little bit more fun as I was finishing out undergrad, as opposed to having to get all of that done there.
Dr. Lott, would you recommend the illustrious gap or enhancement year?
Enhancement year. Well, the program I did was a post-bac program. I got accepted into it at a summer program that I did before I graduated, and that was my gap year. After completion of that baccalaureate program, I got right into the following year's med school class. So it worked for me. I enjoyed it. It helped to solidify the information that was going to be necessary to be successful in med school for me.
And as moderator, I'll keep it short. Yes, I would recommend an enhancement year, AKA gap year. I needed it because of 4 letters, MCAT, that MCAT. I was really focused on achieving my 3.001 GPA score. And I couldn't do that while studying for the MCAT. So I put that off, then I focused all on the MCAT, and I enhanced myself using the MCAT and working, and then I applied to med school. So for student Dr. Chavez and Dr. Shai, the next question is for you guys, since you got to sit out the gap year question. How, on a scale of 1 to 10, I'm adding that part, 1 to 10 scale, how much more challenging was med school than undergrad? And then the second part of the question was, after classes were done in med school, AKA 3rd and 4th year, was it less rigorous? And I'll start with student Dr. Chavez.
I might sound crazy saying this, but I would say maybe like a 4, somewhere on the lower end of the scale. And this is because I spoke to someone from college just the other day. And I think one major factor that changes it is that for medical school, it's pass fail. For most schools, for my school, it is. And I think that really changes how I perceive school is going. In undergrad, I feel like I was very stressed all the time, trying to study so hard and remember every single thing to ace that test. I needed even an A difference between an A minus, B plus, B minus at my school was just a few points. And that felt like that was constantly just a high stress environment and not super enjoyable. But I feel like here at medical school, I'm learning to learn, and it's more content, but I'm doing the best that I can and do well. And I think the schools know that it's a lot to learn. And because of that, they make it pass fail. So there's a lot less like stress, I think, emphasized on like grades, which in my mind, I think that it's not that bad. And then the other part is that I just enjoy the content more, as opposed to maybe like calculus or some other like basic classes that I was taking in undergrad that I wasn't passionate about. Was not as enjoyable, as opposed to now I go to class and I love learning new diseases and the anatomy. I just think it's more interesting. So, and even when I'm studying, I don't think it's as miserable as maybe some other classes were when I was doing undergrad. I think it's kind of enjoyable. And I think a lot just less stress. At least my school really tries to cultivate like wellness and not being stressed.
4 out of 10. All right, Stanford, I like it. Dr. Shy, scale of 1 to 10, what would you rate?
I would have to agree somewhere around there. I think maybe you asked the wrong people. I thought medical school was very, very enjoyable. And it was, I guess we have to give a score. Let's go with a 5. I think the transition to medical school was very difficult. That was the hardest part. And I think after that, it was a complete downslope. But I think the big thing was, I was echo a lot what she said, with basically the content that in medical school that I was doing was stuff I enjoyed. And so I was really nervous and scared because I struggled on the MCAT. But what I was trying to tell myself, and I'm glad it actually panned out, was like a lot of stuff I'm learning here will have kind of not as much to do with me being a doctor as far as the stuff I'll be learning in med school and the kind of practicality as I become a doctor. And I was kind of banking on the fact that I was really good in some of the kind of anatomy and some of the physiology stuff that wasn't really as tested as much on the MCAT. And so I think the transition was really hard because the volume is just so much more. I think the analogy I always use is like drinking water out of a fire hydrant. And so it really was like the first block, which is like 6 weeks, really was about as much as a semester's worth of material. But I think just knowing that I kind of made it to the medical school and I was learning what I actually wanted to learn, and I kind of see the practicality of it, and not just kind of, doing some weird equations or looking at some, I forgot the organic chemistry molecules, but so that was for me. And I think as I got into 3rd and 4th year, it was even easier and even better. Like I said, the time span is rough. For surgery, you may have to get up at 4:30 and you may get off at 8 p.m. or you may have to do a 24-hour call, but I still think that I would rather take that versus, sometimes having just getting beat up studying for the MCAT every day without really seeing any much of results.
Wow. I don't know about everyone out there in cyberspace, but I'm pretty sure nobody was expecting 4 and 5 on how much harder med school is than undergrad. So we're going to increase the sample size here. Dr. Lott and Dr. Freeman, you don't have to give your answers why, but just the numbers. On a scale of 1 to 10, starting with Dr. Freeman, how much harder was med school than undergrad?
So I'm going to go with a 7, and that's all you want.
Yeah, well, 7's good. And remind people your undergrad again. Let people hear it one more time.
My undergrad was Duke University, and then I went to Baylor for med school. And do you want to know my why?
Go ahead and give the why, because
Okay.
I feel it's going to be good.
My why was because it was, I think, balance, where you had then, you were in school full time, but school was like a full time job, and you had, friends who were like, oh, we're going out. We go to happy hour after work. No, that's actually when you go home to study. And so I think that balance part was that much harder. And then the amount of time that we were testing. And then for me, clinical years, I think were a lot of fun. It was great to be there clinically, but you're working full time and needing to study. So I think just really trying to figure out that balance thing, I would up it. But maybe I just had too much fun in college too. I don't know.
Adulting was hard. I get that. I get that. Dr. Lott, what number scale would you give it?
A 4 to 5. The transition for me wasn't difficult. I in undergrad, pre-med major, I was also active in band, was in a fraternity. So I had a lot of stuff going on while I was in undergrad. Med school, the difference in education or the information is a lot like Dr. Shai says. It's like drinking from a water hose in undergrad and then turning on a fire hydrant and then trying to drink that same amount of information. A lot of the information that was learned in undergrad is covered in the first couple of weeks of med school. But the thing that I believe helped me is I'm very knowledgeable of my learning style. I was knowledgeable of how I learned and how to effectively study. So for me, the issue wasn't trying to assimilate the information as much as it was adjusting my style for the volume so that I could take it in and learn it. And for me, I need a nice, steady foundation that I can build my knowledge on. And I had that at my undergrad. I had a good foundation on how to learn and a good foundation of the basics of the different disciplines within there. And that's what helped me to make that transition. So I won't say effortlessly, because obviously there are adjustments that you have to come to, but it wasn't that bad for me because I felt pretty good about it.
So if there's anybody out there scared that medical school is going to be the hardest thing they ever have to do, that it's going to be worse than climbing Mount Everest, we have 2 4s, a 5, and a 7 for the adulting side of it, and not even the knowledge base that comes with medical school. So again, do not be scared of medical school. I want to use all the building blocks we just heard and kind of put it into a clear example you can get right now if you're an undergrad. A lot of people think medical school is taking 6 organic chemistry 2 classes at the same time, when it's more like taking, 6 Chem 1 classes at the same time. It's all like this level of knowledge you get, they're not concepts that are ridiculous, but you're getting a lot of it very rapidly. That's that fire hydrant method. That's why it's still water that comes out of a fire hose. It's water that comes out of a fire hydrant. One's just a lot faster. And a good point that a lot of educators have noted is another message is what student Dr. Chavez just said. When you're not focusing on getting an 89 versus a 90, you focus more on the material. So a lot of schools in Texas have gone pass fail. I was notified that UT Southwestern is not one of them. They still do grades. So if that's a problem for you, that's there. But in medical school, step 1, starting in 2022, is going pass fail. And step 1 used to be, for us old heads, the gatekeeper of all specialties and the gatekeeper test of what you could do in medicine, and it terrified everybody. So now it's going pass fail. We are hoping to see that people will just enjoy the knowledge more and become better physicians in the long run. All right, that was really deep. So I have a fun question while Enrique is going to send me how much time we have left. I want to know if we can go over, under, or what's going to happen there. So the funny question is a myth or not. How Texas should one be to apply to the TMD SAS? Do you need to know Mike Jones' phone number to apply to the schools? Do you need to know what high school Beyonce went to? Or do you just need to have a flag and or shape of Texas on the wall behind you at all times for all Zoom interactions? Anybody?
You need to know how to appropriately use the word y'all.
I like that. Use the word y'all. Anybody else? Texas standards you think you should do if you're applying to Texas?
It's soda. Okay. Bluebell is the only ice cream that is eaten. If it is not called Bluebell, it is not called ice cream. Whataburger is a staple that you have to have. And last but not least, football.
I like it. I like it. Dr. Shaw, do you have any Texas recommendations for those applying?
Yeah, I just say get you a pair of cowboy boots and you should be fine.
Student
And
Dr.
Shipley's. And Shipley's. Shipley's Donuts.
Oh, Shipley's, yes, yes. Them kolaches.
And Tex-Mex. Tex-Mex. That can't be replicated out here, for sure.
For sure.
Yeah, I will agree. As someone who used to live in Texas and left, it's a lot more Texas outside of Texas and a lot less Mexican, and you want the mixture. You want the Tex-Mex. All right. So we're at our hour mark. If anyone has any questions, I want you to throw them in right now. This is your last chance to get a question in. We have to wrap up. My only piece of advice for everyone applying in Texas schools along the last funny, have fun. I do think you need to know that phone number. You know, write it down right now if you're watching. 281-330-8004. Write it down and you will be good to go after that. That's Mike Jones' phone number. It was active. All right. I called it in high school. It was a great phone number. And also know your barbecues. All right. Know your rubs, know your sauces. All right. That's the thing.
Other Texans do not use sauce.
Mm-hmm. It's
all in the rub. If you put sauce on it, you obviously can't barbecue.
Brisket over everything. That's me. If you've never been to a Texas barbecue, you don't know what barbecue is, and you're going to TMD SAS, just walk in and say, can I get some brisket? You'll be good. All right. So I'm going to lock that up there. Anybody want to give any piece of advice off the top of your head right now? We'll go one by one in the same order we introduced ourselves. So Dr. Freeman, student Dr. Chavez, Dr. Lott, and then Dr. Shai.
So I would say that you can do it. You are ready to do it. Be thankful you're from Texas because it's awesome.
Student Dr. Chavez.
I would say get your materials together now, start working on essays so you're ready to go when it opens up. And yeah, you can do it. Just enjoy the process, enjoy going through interviews and the two-way street. You're trying to pick a school, but you also want to figure out where you would enjoy yourself most. So just trust the process and you all can do it.
Trust the process. Gotta love it. Dr. Lott.
You've already made the decision. You want to do it, buckle down. We call it delayed gratification. There are things you may have to sacrifice to get where you're trying to go, but if it's what you want to do, you'll do what you need to get there.
Dr. Shai.
I would say apply broadly. Don't get discouraged by maybe a board score or a GPA. If you do have areas in your application that aren't as hot as you'll like it, try to compensate by having other areas of your application where you are shining. And then when you get to the opportunity, make sure you express that and kind of let the committee know, because that's what happened to me. I didn't do well in my MCAT, but there's still other areas I did really well in, so I was still able to get into medical school. So don't be discouraged by that. And even if you need to reapply, don't let that discourage you either. There's a lot of people who apply to medical school multiple times, and so if you really want to do it, don't let that first rejection discourage you from reapplying the next time.
I love it. And on the close of this piece of advice, as we wrap up, I agree with Dr. Lott with what's been said. You guys are here because you've already decided to do it. It can be done. It's not impossible. You're going to need help. You're going to need pushes. You're going to need someone to lift you up. When we fall down, we get up. Sometimes you need someone to help you up. So go to the places you know you can get that help. All right. Email info@texasjamp.org. Make sure you follow Enrique. Make sure you follow the Tour for Diversity on Twitter, on Facebook, and on Instagram @Tour for Diversity. Or you can email info@tourfordiversity.org. let us help push you along and pick you up, because it's going to be difficult. And if you don't think that following such organizations on Instagram or social media will help you at all, then let me ask you this. Why do you follow Beyonce? Why do you follow all these other celebrities? Because you like them. You want to emulate them. You should want to emulate doctors. So you should follow doctors or follow organizations that can make you doctors. And if you want to apply to TMD SAS, start eating your brisket now. And if you're vegetarian, we do not discriminate in Texas around most parts. So just put salsa on it. You'll be good.
And brisket, even if you are vegetarian.
All right.
Awesome. Thank you all so much. This was some really great insights. Our chats have blown up. We got some phone numbers going up here. We got some suggestions on how to eat vegetarian food. But Dr. Shai, Dr. Lott, Dr. Freeman, student Dr. Chavez, Dr. Anani, thank you all so much for your time today. And on behalf of, shout out to Dr. Matthews, who helped us put this panel together. Just as a reminder, this is the first night of 2. Tomorrow we'll have another panel joining us to discuss what it's like to be a doctor in Texas. So join us here at 7 p.m., same channel. And on behalf of TMD SAS, the Joint Admission Medical Program, Texas Health Education Service, and of course, Tour for Diversity in Medicine, we'd like to wish everybody all the best of luck. We're all here to help. It's not going to be easy, but it's definitely going to be worth it. So we'll see you tomorrow. And thank you all so much once again.
Thank you.
Thank you.